I think we'll get started. Well, welcome everyone. Thank you so much for joining us today. My name is Drew McCartor. I'm the Executive Director of Pure Earth, and welcome to a briefing on the progress of blood lead level surveillance in 5 countries. If you're with us, you have probably seen the swell of interest around lead poisoning in recent months, the launch of the Partnership for a Lead-Free Future, and just a bubbling of conversations around the world about this issue. So in honor of that swell of interest and in recognition of the International Lead Poisoning Prevention Week, we thought it would be a good time to discuss an issue that we are asked about frequently, which is how do we build up public health systems to increase our ability to test children's blood for lead poisoning and to identify exposure sources. We are presently doing just that in 5 countries in partnership with Vital Strategies and with generous support from Takeda Pharmaceuticals. So we're going to be hearing all about that progress today. But before we start, a couple of housekeeping notes. There is a Q&A box down below the screen. Please add questions there. We will have 15 minutes at the end for a live Q&A session, but we will also try to answer questions in that box in writing. So we have program staff that will be monitoring that throughout. So before we get started with our panel session, we're going to start with a short video about this program. And then after that, I'll introduce our moderator and our panelists.
800 million children are lead poisoned around the world, and estimated 292 million of them live in Colombia, Indonesia, Kyrgyzstan, Maharashtra in India, and Peru.
Since 2023, Pure has been implementing with the government of these 5 countries programs to identify, monitor, and reduce lead exposure.
Through the project, countries will be able to better protect children and future generations from lead poisoning.
In the first year of this project, we have made incredible progress toward expanding blood lead level surveillance in these 5 countries,
which is crucial to understand the prevalence and the severity of child lead exposure.
За первый год этого проекта мы провели оценку потенциала лабораторий системы здравоохранения на исследование свинца в окружающей среде и биологических материалах.
Биздинки азыркы окутулган алган маалыматыбыздын биздин максатыбыз жерлердеги айылдык ден соолук комитеттери жана ден соолук жөнүндө кабинеттин адистери айылдагы жарандарга толугу менен бул коргошундун организмге тийгизген терс таасири боюнча маалыматты жеткирүү, андан кийин экинчи этабыбыз ушул эле маалыматты жеткизип, андан кийин балдарды толугу менен изилдөө жүргүзүү.
Perú ha logrado avances notables desde la firma del Memorándum de Entendimiento entre el Centro Nacional de Epidemiología, Prevención y Control de Enfermedades, CDC Perú, un paso crucial para fortalecer los sistemas de vigilancia e información de salud en el país. Desde este periodo, hemos colaborado con la capacitación al personal de salud en regiones estratégicas, aumentando la capacidad para identificar y monitorear riesgos de exposición al plomo.
With technical support from Vital Strategies, to date, a series of meetings have been held with the working group to prepare the first phase of blood lead surveillance piloting, scheduled to begin in Q4 2024.
The initiative involves collaboration not only with the national government in designing and developing this pilot program, but also with subnational authorities across 12 study locations to enhance the resource capacity for surveillance and to actively participate in the field implementation.
Kemudian juga ini tentunya untuk memperkaya statistik kesehatan di Indonesia. Jadi kami di BPS tentunya punya beberapa indikator, beberapa data statistik kesehatan itu akan diperkaya oleh hasil survei kadar timbal darah ini. Data-data tersebut, dalam hal ini data-data hasil SKTD, akan sangat membantu pemerintah untuk menyusun kebijakan yang dapat nantinya menyelamatkan anak-anak Indonesia dari bahaya paparan timbal sehingga mereka dapat tumbuh dan mencapai potensinya secara penuh.
Our aim is to prevent the lead poisoning, lead toxicity. First we will know how it happens, what is the permissible level, what is the actual level in the Maharashtra, and side by side, during the survey activity, during the research activity, we are promoting the prevention components. The people will come to know which product contain the lead, where it is the lead is coming from, and what are the side effects of the lead.
Recently, we had organized state blood lead level training workshop at Pune. Participants were really excited to attend this project workshop, and this is unique and new project for them.
En ese sentido, entonces la investigación tendría que ir a dar cuenta de cuáles son esos focos de exposición, cuáles son esas poblaciones que están siendo afectadas, la magnitud de la afectación en términos del neurodesarrollo y por supuesto cómo empezar a intervenir esas poblaciones para reducir esa exposición.
In Colombia, we have made significant efforts to tackle lead exposure, building key partnerships to protect public health. Through collaboration with national and international institutions and promoting education and awareness in this critical issue, we remain dedicated to create a healthier and safer future for all.
Okay. With that as a nice background about where we're doing this and why and with whom, I'd like to introduce our brilliant moderator for today's event, Carolyn Baylor. Carolyn is a program manager with Pure Earth. Carolyn, over to you.
Thank you so much, Drew, and thank you to everyone for being here. I know for some of you it's late, for some of you it's early, and for some of you it's midday. So no matter what the time of day is, I really appreciate everyone tuning in and listening. And without further ado, I would love to introduce all of our wonderful panelists for today. So to start out with, we have our country director for Pure Earth Colombia, Lizeth Olaya. We also have Indira Zhakipova, who is the director for Ecois Bishkek in Kyrgyzstan. We have Budi Susilorini, who is our director of Yayasan Pure Earth Indonesia. We also have with us Rodrigo Velarde, who is our country director for Pure Earth Peru. We have Debanjana Chaudhry, who is our country director for Pure Earth India. And we also have Yi Lu, who is our senior program manager for Vital Strategies. And finally with us today, we have Yatim Pemple, who is the technical advisor for environmental health surveillance for Vital Strategies. So we really have a great set of panelists assembled today to answer a few questions. And first, what we will do is have some set questions, and then we will go into some live questions and answers from the audience. So if anyone thinks of any questions during this first panel session, please just put it in the Q&A and we will answer them later on. But first off, I would like to start with a question that is directed for all of the Pure Earth country directors for each of the 5 countries that are under this project. So the question is, over the past year of this project, what progress has your country made towards reducing lead exposure? And first, we will start out with hearing from the Peru context. So Rodrigo, would you like to kick us off?
Hello, Caro. Thanks. Welcome to everyone. I'm really pleased to be here and having the opportunity to share something a little bit about Peru. After signing the Memorandum of Understanding with the CDC, the Center of Epidemiology here in Peru, we have held several meetings with the National Direction of Environmental Health, DIGESA, the National Center of Occupational Health and Environmental Protection, and SOPAS, and the Direction of Non-Transmittable Diseases. This has allowed us to identify the 8 prioritary geographical areas that our project will be held, which are Tumbes, Lima regions, East Lima, Callao, Moquegua, Tacna, Cerro de Pasco, and Madre de Dios. I would like to let you know that this work will continue. The previous work that our friends from Vital Strategy has been held here in Peru. And with these 8 regions, we are now covering 56% of the national territory for the surveillance system. We have been working within the technical norm and the sanitary directive related to heavy metals. And with this, we have been able to create an action plan that allows us to evaluate environmental samples like air, water, soil, paint, utilitary, and puff cereals in the areas that I mentioned before. Also, to start working on a program of workshops to identify risk factors within the population using a tool called Ficha Epidemiológica that allow us to gather information from the families regarding epidemiology, occupation, and environmental data. Also, we're gonna be holding a program of updating and training the health personnel in order to participate in the integral attention of all the participants. And also, we're going to start working within each region to identify which are the ways of more important and more relevant communication aspects to gain and to get to the families. So this is in a very brief way all the actions that we have been doing during the past year. So thank you, Caro.
Thank you, Rodrigo. That's a great overview. And I know you have many, many more details and many, many more things to say about the project, but that was a great summary. So now we'll head across the world and listen to a little bit of the context from Kyrgyzstan. So Indira, would you like to share a few words?
Sorry. Yes, first of all, I would like to highlight maybe we'll say the political support for the project implementation from the Ministry of Health. And yes, we signed a memorandum of cooperation with ministry. An interministerial working group has been established, and the capacity assessment of the Ministry of Health laboratories have been conducted to determine platelet levels. Ministry of Health issued the order with identifying the main partners in implementing all project activities. And it is different departments. I can say that the project it's really implemented by Ministry of Health. It is such National Institute of Public Health, Republican Center for Health Promotion, Disease Prevention and Sanitary Hygienic Epidemiology in Civilians Department. It's our main partners. And we purchased all necessary equipment. All this year we were preparing for the starting PLL and home-based assessment in Kyrgyzstan. We purchased all consumables necessary, and we purchased and bring to the country XRF and lead care equipment. It was not easy story, but I mean customs clearance, but finally we won and ready to start with this work in the country. And next week we're really planning to start field work in Kyrgyzstan. Thank you.
That's fantastic, Indira. That's great to hear. And thank you for giving us a little bit more context on what's happening in Kyrgyzstan right now. And now we'll switch it over to learn a little bit more about the Indian context. So Debanjana, would you like to go ahead?
Thank you so much, Caroline, for the question. A lot has changed in the last 1 year in India on this issue. And there have been various policy developments, formation of the technical working groups. So the Indian government has made a significant stride to prioritize lead exposure and reduction and biomonitoring efforts. And this is channeled through the National Center for Disease Control under the Ministry of Health and Family Welfare in India. There is a growing awareness, and there are lots of conversations around partnerships between governments, government agencies, bilateral agencies in India. And there are a lot of conversations that are going into forming high impact and long-term partnerships with key stakeholders for comprehensive lead reduction programs in high-risk states in India. In Maharashtra particularly, we have seen an extreme interest from the government. The State Health Center, the Child and Maternal Health Departments have shown a lot of excitement and are extremely supportive of the work that is happening there. We, along with our partner Vital Strategies, were able to train a host of officials from the state of Maharashtra on blood level testing, and we are going to soon roll out BLL in Maharashtra and then followed by the home-based assessment. We are at a stage in Maharashtra where we have just finalized the surveillance plan, the sampling methodology, the selection of the intervention blocks, and various districts for BLL and HBA conducting in Maharashtra. We also have a very unique and a very exciting thing that's going on in Maharashtra is the way we are getting the support and having all these state actors work hand in hand with us, take equal interest in it. And as you heard in the video, they really want to come up with a solution. There is a very clear indication of coming up with mitigation, and there's a huge focus on awareness and partnership. Thank you so much, Caroline.
Thank you, Debanjana. It's great to hear that overview of how the project is unfolding, specifically in the state of Maharashtra. That's great. So next we'll head over to Indonesia to learn a little bit more about what's going on there. So Budi, it's all yours.
Thank you, Caroline. So hi, everyone. So in fact, in Indonesia, the activities related to mitigating the lead exposure had been around for a long time. But the current development are quite significant in line with the increasing awareness regarding lead in the stakeholders. So these activities are carried out by government and non-government institutions, including the civil society organization, including NGOs, universities, UN agencies, as well as many which are collaboration between these institutions. These various activities carried out, including research to contribute to the availability of the data in Indonesia, policies, including the development of national guidelines or recommendations from health professional organizations for handling lead intoxication, capacity building, remediation of lead contaminated sites, piloting of blood lead level surveillance, and discussions between the stakeholders to have a platform that will be coordinated by the government institution, also to develop a national roadmap to address the issue of lead exposure in Indonesia. And Yayasan Pure Earth Indonesia is glad to be part of this effort, Caroline. And regardless of these developments, awareness raising about lead and also calls to end lead poisoning in Indonesia should continue and will always be carried out. So to make sure that the work on lead, on mitigating lead exposure will keep going. Thank you, Caroline.
That's excellent. Thank you very much for that answer, Budi. That's perfect. And then finally, we will head over back to Latin America, to the Colombian context. So Lizeth, if you could tell us a little bit more about what's happening in Colombia with this project.
Thank you, Caro. I will wrap up in the few highlights that we have for Colombia. First, we are focused that year of work in laying the ground for future interventions through the close collaboration with the National Institute of Health. And together we have been developing the protocol to assess lead exposure to vulnerable populations, particularly for blood lead level monitoring. A key milestone of this year is that we complete a scoping review that allow us to assess the capacity of the country for BLL surveillance, and we have been in discussion with another entities and another stakeholders in Colombia, such as the Family Welfare Institute that is in charge of the group of children that we are attending through the project. And we are looking for the support of the secretariats of health of the local regions that we are doing and performing the blood level sampling and the home-based assessment. And through this collaboration, even if we are already in the process of getting these activities done, and there is a lot of challenging remain. This collaboration has been crucial to raise awareness and to harmonize the efforts between the whole entities of the national health and environmental system in Colombia.
That's perfect. Thank you so much, Lizeth. So it was great to hear from all of the 5 country contexts. And now for the next part of this panel discussion, we're going to open it up to all of our fine panelists so that we can include E and Yatin from Vital Strategies into the conversation. In this section, anybody who wants to answer the question, feel free to do so. And this next question, so as Indira said, not all aspects of this project have been easy. And while it's really important to focus on successes and to look forward, it's also really important to kind of reflect on, any sort of challenges that have come up. So this next question that I would like to pose to everybody is, what challenges have you faced in establishing or expanding blood lead level surveillance programs? And in addition, what sort of strategies have you found most effective in overcoming these challenges? So let's hear first from the Maharashtra context. Yatin, if you'd like to answer this question.
Yeah, sure. Thank you, Caroline, and good morning and good evening, everyone. So, being very specific to Maharashtra, one of the major challenges we faced was how to communicate it to the government the need to set up a blood lead surveillance. Because in India specifically, health is a state subject, and we have seen a lot of momentum regarding lead poisoning at the national level, but somehow it is not being communicated to the states. So onboarding the state health departments of the state government was a challenge, but I personally see this as an opportunity, not as a challenge, because it is very important to convert these challenges into opportunities. And what we did was we had a continuous dialogue with the local health department. We convinced the senior bureaucrats, the senior health officials, the need to have primary data, because it is very important to have primary blood lead data to devise local policy actions. So that was one thing we did, and we were able to convert this into a formal partnership. We have a MOU with the Commissionerate of Health Services. So that was the first important step we did to overcome the challenges. And later on, we also came up with surveillance options document, which was basically different surveillance approaches which the government can implement in the state. And it was shared with the relevant health officials so that they could weigh in their options. This way, we were able to generate their interest and onboard them. So first of all, we onboarded senior bureaucrats, and then we sensitized the senior health officials. And third important thing is, based on this, there was an interest from the government of Maharashtra, and they set up a state working group. And this working group has heads of multiple departments, from child health department, from research department, from the technical support unit, from the surveillance unit, from the training department. So this way, it was important for us to onboard all these stakeholders. So right now, the surveillance approach we are having in Maharashtra is not integrated into the system. It is being implemented by the government, but it is not integrated. So from the long-term point of view, to sustain the efforts, we personally recommend that this surveillance is integrated into their surveys or surveillance programs. Thank you.
Great, thank you, Yatin. Those are all really good points. And I like what you said too, that you consider these more as sort of an opportunity and not necessarily a challenge. So kind of keeping that in mind, Rodrigo, I'd like to call on you for this question. What sort of opportunities have you found?
Well, thank you for the question and the space. So Peru is one of the few countries in Latin America that have a surveillance systems for heavy metals that includes lead. These systems articulate with the different offices, directions, and units, for example, within the whole Ministry of Health. So coordinating could be time consuming, or it could take more time than we can expect it. But we have the luck to get a really good focal point in CDC. So how we solve this kind of problem is having a great focal point, which is Licenciada Laura Naiwa, that help us a lot with coordinating within the different offices that I just mentioned. And also, this system integrates the participation of another ministries, like, for example, education, environment, social development. So having a local and inner contact help us a lot, because we face a huge problem, which is the high rotation of people that are part of, for example, that surveillance. So we can train someone this year, and probably the next year will not be part of the system, of the health system, because of the high rotation. So that's something that we're gonna face, for example, next year, and we will come with a key strategy developed together. Also, we're gonna face different regional situations. Each region has kind of independence in the way they do the work. So we're gonna start coordinating directly with them to join them in their own strategies in order to we are gonna be able to accomplish our goal. So those are the two huge challenges that we're gonna face next year.
Thank you so much, Rodrigo. And yeah, I feel like it's very important, when overcoming these challenges, to have a champion of these issues who's working, very hard alongside you, like Licenciada Laura. That's really great to hear, and very important as well. And do any of our other panelists, would they like to answer this question? Let's see, Indira, would you maybe want to speak a little bit about any sort of challenges or opportunities that you found in Kyrgyzstan?
As I said, it's the main for us big problem. It was customs clearance. It's take really so long time, and now, but as I said, we won finally. But we know, that we are a mountain country, and it's November. Maybe in some our regions can be snowy, and maybe it will be really difficult to get that regions. But I hope the weather will be good enough, and we will able to visit all our planned settlements for study. But if it will be impossible, of course, we will have to postpone till the spring. I think it's the most. It's again because of so long time takes custom clearance. Yeah, we were in this procedure almost 3 months.
Yeah, that's definitely an interesting challenge, Indira, and that combined with the weather as well can be quite challenging.
Yeah.
So thank you for your answer. And finally, Budi, do you want to talk a little bit about the Indonesian context for this question?
Thank you, Caroline. So I think in Indonesia is maybe quite the same with the challenges that are shared, have already been shared with the other country. Another challenge that we have here is that the BLL surveillance itself has so many components, including the stakeholders engagement, communications, laboratories for analysis, and sample collection itself. So therefore, we are going through this process that we need to build a relationship with different parties within the government institution, especially to make it happen. But we are very grateful that we have like cross program and cross sectoral government institution together in this BLL surveillance working group. So it shows that the government has already started to buy in the program, and this is because we have like a very good government partner, which is in this case is the Directorate of Environmental Health in the Ministry of Health, who has been with us along the process. Back to you, Caroline.
Great. Thanks a lot, Budi. That's great. And thank you to everyone for sharing your challenges. And now let's move on to something a little bit different. For our next question, I really want to understand and ask our great panelists about collaborations with government and local partners. So let's talk about this. What collaborations have taken place with government or local partners, and how have they impacted the progress of blood level surveillance initiatives? And for this question, let's kick it back to you, Budi. You had such a great answer for the last one, so.
Yeah, actually, it relates to my first answer that with the complexity and the large scale of work that we are going to do with the piloting of blood level surveillance, the first phase, and also the scope of the activity itself. In Indonesia, it will be carried out in 12 regencies and cities spread across 6 provinces in 4 like islands groups in Indonesia, and plus 1 pre-survey location. So we do collaboration and coordination at the national and subnational level. In the initial state, we collected input from various stakeholders, including relevant ministries, professional organizations, research agencies, UN agencies, universities, and also academia. And during the preparation stage, we had so many discussions with the BLL surveillance working group at the national level, whose members, as I mentioned earlier, comprising from the cross-program and cross-sectoral within the Ministry of Health and also the statistics and in Indonesia. And we would hope that this engagement will continue throughout the implementation. And in fact, we are also going to invite the BLL surveillance working group to go with us to the field so that they can observe it by themselves, how the work is going to be implemented on the ground. Because we would hope also, together with this BLL surveillance working group at the national level and also our field partners, will do like a evaluation together about the program and to get like a lessons learned that we can use for the next phase. And as we are approaching the implementation, we also coordinate with the government at the provincial to the regencies and also cities level, primary health clinics and environment public, both public and also private laboratories, which will be our partners for data analysis. So these are the institutions or the parties, people who will be our main colleagues for implementing blood level surveillance in Indonesia. Back to you, Caroline.
That's great, Budi. As you can tell by Budi's answer, I mean, a project of this magnitude and this importance requires articulation and collaboration and input from a lot of different stakeholders. So that's excellent. And Debanjana, do you want to talk a little bit more about the collaborations that are going on in Maharashtra?
Absolutely. Thank you so much, Caroline. We were in Maharashtra, it's just that, as my colleague from Vital Strategy said, Yatin said that, the Commissionerate of Health and the Commissionerate of Health in the State Health Center, we were able to extend an MOU with them and extend the current partnership. And we are now looking forward to integrate the BLL and the biomonitoring system in the health sector per se in Maharashtra. In Maharashtra, we were also able to establish the Maharashtra state-led working group, and it meets periodically. And apart from the current work that is going on BLL and HBA, there are also discussions within the state working group about what are the different sources. There are many think tanks who come to these meetings, experts who talk about, what needs to be done in maternal health and child health, what needs to be done in terms of regulatory processes. So there's a lot of brainstorming and churning going on through this working group in state. Apart from that, we also have a partnership with AIIMS Nagpur, for the HPA, the home-based assessment implementation. And this partnership allows us to go to households where blood level would be conducted, and we are just currently waiting for the ethical review. Apart from that, there's a letter of support, and basically, it's a multi-stakeholder engagement that is going on in Maharashtra for us beyond just the project of Takeda. Of course, the Takeda project has helped us create that basis, and it is taking wings. As I said earlier in my opening remarks, is that there is a lot of excitement, there's a lot of acceptance. People want to make change. There are agencies that want to make the change happen, and they're all joining hands with us with vital strategies in order to let that happen. So in the coming months, we are going to see more partnerships, formalized partnerships coming in the state of Maharashtra. Thank you so much, Caroline. Back to you, please.
Thanks a lot, Debanjana. And yeah, that's a really important point that you raised, that, this project is so important, this project funded by Takeda. But the hopes too is that, with the momentum created and the collaborations created under this project, that will also continue, and the focus will stay on lead, since it is such an important issue around the world. Do any of our other panelists want to talk about the collaborations that have taken place with governments or local partners? Let's see, Rodrigo, do you want to go?
Yes, I would like to highlight the will of the CDC of Peru in help that allow us to help them to implement and improve the existing surveillance system that we have here in Peru. It's really important when the government is willing to join or receive efforts from international cooperation. And we're really proud that we can continue the work that other international cooperation agencies have been doing, like vital strategies. And we can see in tangible numbers that we are incrementing the number of regions that are covered by the surveillance system, which is something great. This is a 56% coverage, which is something that I think we all should be really, really proud. Thank you, Caro.
Perfect. And I also see Lizeth. Do you want to answer this question as well?
Thank you, Caro. Yes, I would like to add that, as well as Budi, we have been working a lot with the universities, and this is a great effort because they have previous experience regarding research, the research part of this process of heavy metals. So it's really good to know for their experience, because these processes are part of a synergy as well. So if we have that experience, we can have lessons learned and the best practice that we can implement to optimize our resources. And in Colombia as well, we have the support and the experience of the Pan American Health Organization. They have been working, we have settled with them a framework agreement for working mostly in the educational part of the process of the project, but they are a strong stakeholder in Colombia because they have the support of the authorities in the health system, and they have this authority to share with us as well the experience. So we are doing this kind of interesting synergies with those two actors as well.
That's great. And that ties in with the point that, a project of this magnitude really needs input from, everybody involved, whether that's, NGOs, of course, the government's involvement is crucial, as well as, from the private sector, and then academia too plays a really important role in this. So I really love highlighting that. And does anybody else want to answer that question before we move on to the next one? Okay, perfect. So the next one, let's switch gears a little bit. We've talked about challenges, we've talked about collaborations. Now, an important part of this project will be communication. So communicating with the different communities. So the next question will be, what kind of public education and community engagement efforts are you deploying in your program? And so let's start off with Kyrgyzstan. Indira, would you like to answer this?
Yeah. First of all, a communication strategy has been developed to outline the overall direction of our efforts. Informational and educational materials about the harmful effects of lead on health have been adopted for public dissemination, including posters, leaflets, and booklets. An animated video highlighting the health risks of lead has been created, along with the interviews and video reports. Training of trainers, TOT sessions have been conducted for health committee specialists from the Ministry of Health and research groups. The main covered topics, it was disease caused by lead, including definitions, symptoms, diagnosis and treatments, research on blood lead levels in preschool children's, studies on lead levels in environmental objects, and effective communication approaches and community engagement, emphasizing the importance of communication skills, conversation techniques, and non-verbal communication. Information is being disseminated through social media platforms, including Instagram, Telegram, Facebook, and YouTube. Our organization has their own pages on these platforms, and leaflets and messages, information materials, and video reports was posted on these platforms, and we can check that the visitors of our pages raised really sharply, and it means that this subject, this theme, really interesting for the population. Engagement efforts include involving healthcare workers from primary care centers, teachers, students, government employees, local self-government bodies, community organizations, religious groups, and media outlets. Educational initiatives for partners include organizing training sessions for school teachers and parents during meetings, focusing on healthy lifestyle and disease prevention, supported by methodological materials such as guides, instructions, models, and handbooks. Now we are preparing such events as a quiz night for university students and the informational actions in schools, because it's in connection with this week of lead, Global Week of Lead, and we prepared some press conferences, radio interviews, and all these events are being organized. These all coordinated efforts aim to create a comprehensive awareness campaign, ensuring that the community is informed and engaged in addressing issues related to lead exposure. Thank you.
Thank you so much, Indira. Yeah, as you can see by Indira's answer, there are many different sort of ways to communicate with people. Some people prefer a printed method such as leaflets. Other people are a little bit more electronic now, so social media is kind of the best way to reach them. And there are many, many different audiences as well. So it can be sort of complex to kind of figure out which tool would be best for which audience, and then, create the right sort of materials to target that audience. But I really love in particular hearing about the quiz night for university students. I think that's a fantastic idea and something fun to get the information out. So that's great. And let's hear from Budi now. What about in Indonesia? What sort of communication efforts are going on?
Thank you, Caroline. So both public education and community engagement efforts are important things that are like inseparable from the blood level surveillance that will be implemented in Indonesia. So not only to invite parents to include their toddlers in this activity, but also so that the publics will know all about lead and measures to prevent lead exposure and how to protect their families. So for that reason, we have prepared communication strategies and also plans, among others, to produce IEC materials and approaches that are suitable for conditions in Indonesia. And even we are planning to have a mascot that we are going to use in all public education that we are going to implement in Indonesia. And for the EIC material, they will be developed with sustainability in mind, so that it can also be used beyond the BLL surveillance activities. Therefore, during the development process, we consulted with the Directorate of Health Promotion in the Ministry of Health, and we are also get like an interest from the Indonesian Pediatric Society also to work with us in the development of this public education and also all the IEC materials that we are going to use for communications purposes. Back to you, Caroline.
Thanks a lot, Budi. Really appreciate the answer, and I'm looking forward to seeing what the mascot looks like for sure. And now for this question, I'd like to get a little bit of a global perspective as well, because poor E is on the panel, but she's been sitting here. So E, I'd like to call on you for this one, because E works very closely with all 5 countries, and so she can give a little bit more of a global kind of overview of this question.
Yeah, sure, Carol. Thank you. Yeah, I think, the other very important perspective that we're also emphasizing for health education and engagement is actually the health education and engagement with the healthcare professional community. So I think there for providing, that's also one of the goals that we're moving forward, that we would like to hope to provide, health training for health professionals, as well as the community health workers, especially for, I think, in India, in Indonesia, and also in Peru, many of these rural communities are only reached by, community health worker, and they can serve as a very important point to provide to provide information and engagement with these communities. So I think that's one of the other perspectives that I would like to add here, that will move forward, that thinking about community engagement and education.
Great, thanks a lot, E. Does any of the other panelists, does anybody else like to answer this question? Okay, perfect. I think that's a really great overview of the educational efforts. So I think we can move on to our final question before we start the Q&A session. So just as a reminder, if anybody has any questions, to put them in the Q&A, and we will either provide written answers to them, or we will answer them live in just about 10 minutes. But for our final question, we really want to kind of turn a little bit to the future now that we've talked a little bit about, what's been happening over the last year or so. We'd really like to kind of look forward. And so this question is, what impact do you see this blood lead level survey data having on future interventions and policies to combat lead poisoning on a national scale? So a bit of a big question, but an important one as well. And let's start with the Colombian context. Lizeth?
Thank you, Caro. The data in this case is the most important thing for the process in the case of Colombia. And this is because this is going to shape the future interventions and policies that be conducted in the country. The most important part of this process is that we are going to be able to give the government the evidence that they need to prioritize this issue in the public policy developments in the coming years. And we are going to be able as well to centralize the efforts in the most vulnerable population and target all of the solutions and the activities of the project in those areas that we can see through the data and the information and the BLL and HBA results that they are most needed in help in this regard. In Colombia, what we have seen is through the regulation, we have the regulation for lead. We have, I want to believe, a strong system, a strong regulation, because we have the regulation, the public policy, the systems for information, and the institutions that work towards and regarding the prevention of this kind of issues in health. Nevertheless, this is why we are needed to punctualize in lead, because there are so many things to work in the country, and the evidence is key for prioritize this issue. We can influence policymakers, we can influence other stakeholders through this data and to promote synergies and other strategies that allow us to have a bigger impact in the country, and to allocate those resources, the need resources, in the right places to have a better impact in the country. And ultimately, the goal that we are expecting is to all of these efforts, all of the team efforts that I want to thank in this opportunity, because without the technical support of all our team members, it is impossible to achieve these results. So I want to thank them. They are here backstage answering your questions and being attentive of this space. So the most important is to translate this information, this data, and these efforts into actionable policies, because the regulation without the enforcement doesn't have the same results, doesn't have the same impact, and at the end we can prevent these issues in children's health and whole population, vulnerable population health, if we have a stronger evidence in this regard.
Great, thank you so much, Lizeth. Let's turn it over to E again for a bit of a global perspective. E,
Yeah, thank you, Carol. Yes, so I think Lizeth provided a very good input already, that I think overall the surveillance data is often the first step for us to raise awareness of this very important issue in many countries. While we have available global model data on the blood lead levels, but often the local data are very necessary to verify this estimate locally, and also to provide a finer scale of the data, as Lizeth also touched on, that help prioritize the resources and the policy development in the country. So I think, I would like to break it down to like two parts. So one part is about the policy intervention. I think during the surveillance, in addition to the information we collect about blood lead levels, we also use a questionnaire to collect what might be the risk factors related to lead exposure. And these linkage between the blood lead level and the risk factors can be a very important clue and information for the government to identify what might be some important sources of lead exposure in the country, and therefore help the country to prioritize what might be the sources of lead that they need to target through policy. So I think that's something we have seen in many different countries, but I would particularly say in Peru, for example, lead exposure has been well known to affecting, communities living in mining practices. But I think during our last, round of national efforts of testing blood lead surveillance would have surfaced that there's also potential lead exposure through paint. And therefore, there's quite a lot of more interest and efforts in regulating lead in paint that have been developed as a follow-up. So that's one example. And then going to interventions, I think, it's very important when we talk about the interventions. There is also an importance in identifying the cases as well as providing, the early detection and the appropriate care in this case. And I think, this is also where when we are conducting the surveillance, we're in many of the countries where the reason why we are trying to work with, the health ministers or the local health department in conducting this effort is to also provide local capacities and also understanding in these issues, and how do we detect, and now how do we refer these cases when we identify them. So there is a continual effect of the awareness that raised among these health workers that continue to pay attention to this effect and continue to identify children living in these communities, and then help to refer them to early detection and intervention. So that's also where, in a case in India, for example, when we provided training, we provide training to the medical officer at district level, and these are officers who are, continuous working with community health workers and local health workers to and then pass on this information about how important it is to identify children and refer children and manage children with lead exposure. So that's also where we see some continuous effect on improving the intervention and early identification care for children. And the other one that I would also quickly touch on is that, for example, the local efforts. So in India, we're working at the state level, but now we're seeing national level having the interest of building a national potentially monitoring system for children with lead exposure. And our work in Maharashtra is very important in demonstrating the plausibility and can be featured as an example for the country. So those are all kind of important implications we can see from the surveillance effort that we're doing through this wonderful project.
Thanks, you raised a lot of really important points and some really great points there. So we've heard a little bit now from the Colombian context and sort of a global transversal context. Would any of our other panelists like to speak about their situation? Let's see, I know E mentioned a little bit about Peru, but Rodrigo, do you want to sort of elaborate on this question? Again, I'll repeat the question. What impact do you see this blood lead level survey data having on future interventions and policies to combat lead poisoning on a national scale?
Yeah, thanks, E, for what you mentioned. And this is really important because using the tool that we have here, which is the Ficha Epidemiológica, allow us to identify new possible risk factors. And it will be really interesting to see how the data turn into policy, because we're going to show some evidence and key evidence about actual risks. So I know that the CDC is really interested in gaining more data in order to improve. As he mentioned, we are now legislating on paint. Let's see what's the new step regarding to possible exposures and how that translates into policy.
Great answer. Thanks a lot, Rodrigo. And let's turn a little bit to the Indonesia context. Budi, would you like to say some words?
Yeah, thank you, Caroline. I think similar what has already been mentioned by colleagues in Indonesia. The BLL surveillance, not only we are going to get the data about the prevalence of the BLL, but also because we are going also to do the home-based assessment, that we will know about the potential sources of exposure in Indonesia. And together with the National Research and Innovation Agency, which has been assigned as the principal investigator of this activity, together with us, Pure Earth, and also Vital Strategies, we have agreed to produce a policy brief from this activity. And this policy brief is expected to be a basis for further discussion for the formulation of appropriate strategies, policies, and also intervention programs. And for sure that we are going to discuss this policy brief mainly with the government stakeholder, but also during the discussion, we are also going to connect with the other relevant stakeholders. Thank you, Caroline.
Sure, thanks a lot for the answer, Budi. And Indira, I see, did you have your hand up?
The Minister of Health anticipated that the study will address existing knowledge gaps regarding actual lead levels in children's blood in Kyrgyzstan and identify the primary sources and the pathways of lead exposure. The findings will provide a foundation for developing a target public health program aimed at reducing lead exposure and mitigating its adverse effects on children's health. The initiative will contribute to improving the population's quality of life, lowering healthcare costs, and enhancing social welfare. Based on the results, the Ministry of Health will justify the procurement of essential laboratory equipment to facilitate monitoring and advocate for medical assistance for affected children. Additionally, Ministry of Emergency Situation will utilize the research findings to promote and expedite the reclamation of toxic tailings and waste dumps. Yes, if will we say about ways to address the issue in general, increasing awareness, knowledge, and competence. It will enhance public understanding of lead exposure and its health impacts. Development of regulatory legal acts and the clinical protocols, because Kyrgyzstan doesn't have this clinical protocol on lead treatment, and it's our maybe future work for next year. And this established legal framework and guidelines for managing lead exposure and its health consequences. Inclusion in public health programs. It's preventing measures and diagnostics for non-communicable diseases will be integrated into the Healthy Person is a Prosperity Country public health program for 2024 and 2030 years, which include equipping laboratory with the necessary tools, implementing a quality management system, establishing epidemiological surveillance for heavy metal poisoning, including lead, using digital medicine, data analysis. It's conduct analysis for morbidity and disability data, as well as laboratory monitoring results of environmental objects, food products, and consumer goods for lead contamination. And priority activities identification. Based on research findings, establish priority actions to create a sustainable system for supervision, control, diagnosis, and treatment. Standards and clinical protocols development. Create and implement standards and clinical protocols, including if lead is detected in paints, increase customs control over paint imports. If lead levels are found even below 5 milligram deciliter in children during the study. Implement national screening as a priority. Strengthen control on emission from large enterprises to ensure proper treatment of discharges. Yeah, thank you.
That's great, Indira. Thank you so much. And as the audience can probably tell by the variety of answers and the robust answers as well, this is why collecting this blood level data is so important, because it can inform so many future actions. You know, we've heard anything from policy changes mentioned, you know, interventions of the children with elevated blood levels, establishing priority actions, laboratory equipment, capacity building, and so much more. So that's why this stage of the project is so important, and it's been really great to kind of hear about the progress that's been happening so far. So thank you to everyone for answering those sort of set questions. We're going to shift gears a little bit now and move on to the questions that have been asked by the audience so far. We see that we've gotten some really great questions in. So we're going to look at those right now and answer them. And any panelists that want to jump in and answer any question, that will be great. So we'll start out with the first one, which is, how do you assess the availability of public information about lead exposures in your countries? And I'll repeat, how do you assess the availability of public information about lead exposure in your countries? Let's start in this case with, Colombia. Thank you, Lizeth. I see your hand up. Let's start there.
Thank you, Caro. I mentioned it before, but it was really a really interesting exercise for us because the National Institute of Health recommend to have this evidence that in the country the country have previously studied lead exposure. So through the scoping review that we did on advance with the National Institute of Health, we have the option to get with those researchers and those institutions that have been working on lead and build this database and articles and information that allow us to see where they are looking for lead, which sources of exposure we have been identifying, with which populations. So it was through this exercise, through the research part of the process before getting into the intervention.
Great answer. Thank you, Lizeth. And over to E, who also has her hand up.
Yeah, thank you, Carol, and thank you for this question. I think this is a very interesting question. I mean, in a way that in the countries that we have been working here, we haven't been, seen available like national level data or representative data that is available in these countries. That's why we're going into this country to really work on this issue. I mean, for the previous blood lead level, for example, I think across all locations when we were developing the capacity assessment report, one of the important sources are actually the previous studies that have assessed the blood lead level among children that are conducted locally. Those provided some really important insight for us, and then we kind of tend to categorize the studies to two categories. One is focusing on the communities that live near a contaminated site and they're expected to have higher level, and then either the control group or the more representative like local studies that randomly collect sampled children. Those are the ones that we're considered more closer to the population level in the country that we're working in. So I think that's also it's not necessarily the public information released by the government, but it's also a very important source of information we often consider. And I think in several countries that we're working here, I think in Peru, there are also informations that are particularly assessing lead in environmental samples. Or for example, in Indonesia, I think Pure Earth did a great job of creating a database of lead related contaminated site. Even though these are not the directly blood lead informations like lead exposure, but they also can be indicated of where the lead pollution and exposure might be occurring.
That's perfect. And let's see. Let's move on to Budi now because I see your hand is raised as well.
Thank you, Caroline. So in regards to Indonesia, I think what I'm aware of, there is like a national data. The data is still scattered to the universities, institution, or researchers who conducted the research about the lead exposure. So it has not been pulled into like a national data. Yeah, as E mentioned that, for example, Pure Earth has already done this toxic site identification program, and we have already made it available to the government of Indonesia so that they can integrate it into the national database. But I think the data is also limited only to the government officials. In this case, is the Ministry of Environment and Forestry. But we also have like a summaries that we put in our website, which is accessible for public. And for the data that we are going to get from this BLL surveillance, we have been had this initial discussion with the Directorate of Environmental Health to build this information system. But it may not be available for public yet, but the data and information will be made available at least for the primary health clinics. So if they want to know about the lead exposure in their area, so that they can find it out in this platform. And we are together with the vital strategies, we are going to work closely with the Directorate of Environmental Health on what data or information that we can pull out from this BLL surveillance and what to be put in this platform. Back to you, Caroline.
That's great. Thank you, Budi, E, and Lizeth, all for your answers. In the interest of time, we'll move on to the next question. So let's talk about now, what screening tools do you use? Is it venous blood or arterial blood, says the question. Have we done any efficacy study of the technology? And could you share the pathway of screening and referral? So a little bit more of a technical question here. Okay, E, I see your hand.
Yeah, hi. Thank you, Kara. Yes, so I think in most of the locations for now, we're considering using the portable analyzer, which is, I think the only one that have been certified by FDA now is LeadCare. So the LeadCare will be used as our screening technology for lead exposure. And as some of people are also know that LeadCare has been used as a screening tool even in the US, in some of the states as well. So it's a pretty widely used tool. There has been quite a few validation studies, not just in the US, but also there have been validation studies conducted in Peru, in India. And then we have seen, as I mentioned before, we have done literature review. We also have seen LeadCare used in Colombia and in Indonesia in the local studies before. So we have some confidence about its performance in previous study. But as I think the rightly pointed out by the question, there's also some concern about field contamination, both related to capillary blood and also related to portable analyzer. So in addition to the portable analyzer and capillary blood, we're also collecting about 5 to 10% of sample using venous blood and then sending to the laboratory for validation of these studies. So in a way, our own study will also include a validation process to see how the measurements from the portable analyzer is aligning with the laboratory assessment. But we have seen studies that seem very good correlations between the LeadCare measurements and then the laboratory measurements.
Okay, great. Thanks a lot, E. Yeah, very important to have that quality control. So moving on to the next question. Let's talk about, has there been any research that has established lead poisoning / lead contamination as a major risk factor for stunting or malnutrition in children in their country? Budi, would you like to answer this one? I'm putting you on the spot.
No worries. Actually, this is also in Indonesia, stunting is like anemia and stunting is two of the biggest issues in Indonesia. And when we try to do back when we did the BLL study in 2023 with the Faculty of Medicine of Universitas Indonesia, when we went to the health agencies, they also wanted us to try to incorporate like how to connect like a BLL also and stunting. But unfortunately, maybe E and Yatim is has like a more competent to answer this question in terms of the health issues. But what we learn is it is not an easy thing to connect both like BLL and stunting. So there for example, we decided not to to do this both and try to find the connection, because a lot of like tests, checks that we need to go through for these toddlers. So unfortunately, I could not answer. I haven't had we haven't had an experience on that, Caroline.
No worries. Thank you for your answer, Budi. And I heard that you shouted out Yatin in your answer, so I'm going to also put him on the spot as well. So Yatin, the question was, has there been any research that has established lead poisoning or lead contamination as a major risk factor for stunting or malnutrition in children in your country?
You want to take that? You have your hand raised.
Yes, I can jump in. And Yatin, I think you can talk a little bit about later how Maharashtra might be able to incorporate some measurements related to malnutrition and stunting. But so, Carol, just to respond to this question, I think we have seen some studies, localized studies, in both Indonesia and India, but also elsewhere in South Asia and Southeast Asia area, and also I think there has been some studies coming from Latin America as well, linking the potentially the linkage between lead exposure and stunting. But as Budi is pointing out, I think the scientific evidence that we have accumulated on stunting is not as much as the other ones, partially also because stunting is a complex issue that are affected by many other factors. But on the malnutrition, there have been a lot. I think there is a chicken and egg issue, because basically malnutrition and lead poisoning also interact with each other. So for example, children with iron deficiency or like calcium deficiency, they're more likely to absorb more lead as well. So there's an interactive effect between the lead and malnutrition, but generally, they are a problem that can intertwine with each other and can exacerbate each other. And the other thing I would also point out is actually, for example, one of the common intervention we're also recommending, and WHO guideline also recommended, is actually to provide calcium, ion, and vitamin C rich diet or supplements in areas where children might be suffering both lead exposure and malnutrition. So these are definitely like problems that should be seen and can be tackled together.
Okay, great answers. And Yatin, I see your hand up now.
Yeah, sure. So in Maharashtra, in our lead risk assessment questionnaire, the survey tool, we have added height and weight of the participant as one of the variables. So we'll be exploring this factor in Maharashtra, and of course, we'll share the findings.
Great, thank you for that. That'll be good to have a little bit more data to complement all the research that's been done so far. And great, we'll have time for probably just a few more questions before we wrap it up. And the next question that we see in the Q&A is, I'm a strong believer in blood lead surveillance programs, but many programs stop there and do not have a way of treating children with these high blood lead levels. So the question is, what systems for follow-up care and treatment are being put in place in the various countries? Debanjana, that was fast. I see your hand up.
Thank you so much. I'm not very aware of what systems holistically are there in India, but definitely we have seen I'll share the example of Bihar, where we have already done blood lead level surveillance followed by home-based assessments. And wherever we found that some children or individuals had high elevated levels in their blood, there was always a mechanism to refer them to a healthcare provider. And in India, there are there are a lot of institutions, there is growing awareness and availability of treatment for elevated blood levels. But is it enough is the question. It isn't enough, but certainly there is a mechanism. It needs to be robust. But I will also toss it a little bit to Yatin to share a little more about the Bihar context, where we have already seen that we have done some references. We have sent some of our respondents to healthcare providers and how they got treatment. We also have anecdotal evidence of in other states as well, wherein there have been treatments that have been made available for many individuals, many children, some with success, some with not as much success as we would have liked. I'll stop at that. And Yatin, I'm again putting you back on spot, but I see your hand is already raised, so maybe you have something to add. Thank you.
Yes, Yatin, do you want to go ahead? And then I see a few other hands, but
Yeah.
please continue with India.
Sure. So in Maharashtra, when we did the capacity assessment, we also assessed the availability of chelating agents, basically in the state. So there is a national list of essential medicines which is available in India, and we explored whether the chelating agents are there in India or in Maharashtra or not. So that was one of the things we did before the project, before the start of the project. And also when we trained the surveillance teams, clinical management was one of the sessions we did for the master trainers, because it was important for the medical officers to know what are the aspects of clinical management. So that is what we did in Maharashtra.
Okay, great. Thank you, Yatin. And I know we're just about to wrap up, so this will actually be our last question, but I do want to make sure Rodrigo and Lizeth get a chance to answer. So Rodrigo, do you want to go ahead?
Thanks, Caro. Yes, just to mention that in Peru, we have a surveillance system that is taken account by the Ministry of Health. So when a kid is presented high blood lead levels, it's referred to the health system. So that also includes a possible treatment and part of also a strong part with the parents about giving them advices on how to reduce the lead, the blood lead levels. So this is part of an already established system. So this is not just a project that has like, hey, we're gonna say the blood lead levels. No, if this kid or this family has a member that has high blood lead levels, the system will take care of that.
Great. Thank you, Rodrigo. And Lizeth, do you want to wrap us up?
Thank you, Caro. In Colombia, we have the law 2041 from 2020, and this is a great law for the country because it has a preventive approach to vulnerable people like children and pregnant women, so the threshold for them is lower. And in the health system of Colombia, there is an obligation to attend children and population that get lead levels above this threshold. So in Colombia, we have this setup system to prevent those issues.
Perfect. And thank you to all the panelists today for all your great answers, and also to all the program staff who has been working behind the scenes to answer everybody's written questions as well. I think I will kick it over to you, Drew, to close us out.
All right. Thank you, Caroline, for a brilliant job moderating, to our panelists for a wonderful conversation, and to everyone who joined us. A recording of this webinar will be available at pureearth.org if you'd like to review it or share it with colleagues. You can also learn a lot more about this Takeda-funded program at the dedicated website for the program, which is reduceleadexposure.org. And then if, this is not the only program that Pure Earth or Vital Strategies are running related to lead. So if you want to learn more about other efforts to address lead exposure, follow each institution. Pure Earth is at Pure Earth Now on social channels. Vital Strategies is at Vital Strat. You can also send in additional questions to us at info@pureearth.org. And with that, hope everyone has a great rest of your day. Thanks for joining us.